In the battle against COVID-19, Burlington is fortunate to have two soldiers in our corner. David Adams, president of AFC Urgent Care, served as an officer in the United States Marines, and Dr. Christina Oreo, who saw active duty as an emergency medicine physician in the Air Force. Dr. Oreo likened COVID testing to combat experience.
In many ways, it's very similar. I mean, we are fighting a war here, against a virus every day. And when we run these large-scale drive-through events, it is like running a mass casualty exercise in many ways.
Large-scale drive-through events we're running now, we're actually taken out of the military playbook. Dr. Oreo and I both ran a lot of mass casualty and a lot of vehicle checkpoint events. And to be able to apply those same principles to a large-scale drive-through testing event creates a safe environment, and it creates a safe, healthy environment for the patients too.
With our 6 clinics, we're rotating our large-scale drive-through events, and we're doing 3 a week in different locations so that we can contact multiple communities and try to get as many people tested who are symptomatic as possible.
AFC Urgent Care is especially equipped for COVID testing.
We're one of the few locations in the state that has access to the Abbott Labs rapid molecular test, largely because there's a shortage of machines, and we have plenty of the machines because for many months we've already been using that same machine and the same technology to provide molecular flu testing for the communities. And so we were able to convert those machines and upgrade the software in those machines to be able to use the rapid COVID test that we believe, based on its technology, is approximately 98% sensitive. It's a very accurate test.
The process for being tested starts with a phone call.
The patient calls us, we send them a text to their phone, they open up the text, and they can immediately be in the application and see our provider on their phone, and our provider can talk to them about their symptoms, their exposures, and determine whether or not they should come through our event.
This reporter followed drive-through procedure and was tested for COVID-19.
The patients arrive on site to the security checkpoint where they present their ID and show us their doctor's order that we've presented to them during their telehealth appointment the day prior. They move through the registration process.
How's it going?
Good.
So I just have your registration form here.
Confirming their identity and move to our triage station.
Thank you. My name's Casey. This is Bree, okay?
Hey.
We're going to do your vital signs, okay?
Triage, they are tested for COVID-19. They're tested for rapid strep. Their vitals are taken. And from that station, they can move into the examination space where our providers can counsel those patients, can examine those patients, can confirm vitals and make sure the patients are feeling okay.
Have you had any fever or chills?
Nope.
Any chest pain, shortness of breath?
Nope.
Any cough?
Nope.
Any sore throat?
No.
And most importantly, that the patients have a clear understanding of what the CDC guidelines are around isolation and quarantine.
You need to stay in quarantine for 7 days from symptom onset.
We then take those results, and we are taking those results, communicating those to the State Department of Public Health as we are required to do, and also to the local public health department as we are required to do, so that those two entities can contact trace the patients effectively and keep, again, those communities safe.
If you develop severe shortness of breath or chest pain, you'd want to go to the emergency room. I'm just going to listen to your heart and lungs, okay?
We're very busy. We're running about 200 to 300 patients every time we run these events. What we're seeing is about a 30% positivity rate, which is high. But what this allows us to do as well in these drive-through events is to do a brief exam on patients and make sure that their vital signs are stable, make sure that clinically when we listen to their heart and lungs that they're doing okay. And it also is a really important contact point for us to counsel patients on self-isolation and quarantine, whether their result is positive or negative, what they need to do. And it's a point in time where patients can ask our providers some questions on how to do that.
AFC Urgent Care is also preparing for post-COVID healthcare.
We believe in the coming weeks we are going to be testing also for antibodies, likely with another rapid finger prick test. And so we will be able to test 200 to 400 patients a day using in each of our locations, covering testing for both the active live virus and antibodies to see if they have been infected and likely have developed some form of immunity to the virus.
Thankfully, this reporter tested negative for COVID-19 and strep throat. And BNEWS sends its thanks to all the healthcare heroes on the front lines. From AFC Urgent Care in Stoneham, I'm BNEWS reporter Tad Stefanak.